Hospice of Redmond started in 1979 with a nurse and a doctor. A group of professionals came together and wanted to care for our community and make sure that they could have the death that they wanted, which was a death that was in their home. And that's what we're still doing. We have a whole interdisciplinary team that goes into homes and takes care of patients wherever they call home.
Hospice is such a scary word, and I love it so much. It's very important to me what we do. We offer so many things more than just hospice with our transitions program, and being open to so many things in the community where we need help. We can step out and just do so much more for people than what they know.
We provide bereavement services, grief support in schools, a grief camp for children called Camp Sunrise. We also have a program called Pet Peace of Mind, where we're able to allow families to keep their pets or a patient to keep their pet with them. We are also proud to support veterans. We have a veterans wall on our property that people are able to put a name of a loved one on that wall. The Honor Guard supports us and comes and plays taps at the wall every third Wednesday. We go out to veteran patients' homes. We try and provide them with a veteran volunteer to support them at end of life. And we also pin those veterans and thank them for their service.
I've been with Transitions for just about a year now. And Angela is my contact person. We met through the fact that my wife is in hospice. You know, it's been a great help to me personally. In fact, the chair that I'm sitting in is a result of Angela's work for me. If I didn't have her, I don't know what I would do. Try to go out and find somebody, you know, a relative or somebody that would be that kind of assistant would be very difficult to find. The stability that Angela brings to our living conditions is very, very helpful.
Larry was diagnosed with Alzheimer's in 2015. It was like watching him die day by day. When the doctor finally suggested hospice, I was really hesitant, and so was he. When hospice stepped in to help and they took over all the hard things for me, I was able to be my husband's wife again and not just his caretaker. And that meant everything to me. And Larry loved them and couldn't wait for them to come back. Every time they visited, he'd say, "When are they coming back?" It was a very good experience. Without hospice, I wouldn't have been able to be totally present for my husband and be there all the way through the end. They are still to this day my angels.
Our team came together to start strategic planning for our organization. And so we really wanted to try and look at things that might be a gap that we could help fill. And what we see as a need is for people to have primary care service in their homes. And so we are honored and excited to be bringing a primary care service in home to patients that need that.
We have been doing this since 1979, and to watch it grow through the years has been amazing because our programs just keep getting bigger and bigger. And primary care is hard to get right now. So we're really looking forward to this program to bless more of the community in any way that we can. It's about how you want to live your life, not about how you want to die.
We serve more than Redmond. We do more than hospice. And so what we want to do is offer a clear path for Central Oregonians to hospice, transitions, and primary care. And with that comes a new name. And that new name is going to be ClearPath Healthcare. When you've been a name since 1979, it's a big deal to make a change. And what I want to make sure that people understand is we're the same organization.
To make the change that we're about to do is really hard, but it's who we are. We are rooted in this community, and we're not going anywhere. We are just going to go and help more people and support more families with what we're about to do.
We're the same community partner that you've always experienced, and we're still the nonprofit that you've always loved and partnered with.
Why choose ClearPath Healthcare? It's because it's rooted from Hospice of Redmond.